So this is your first time tiptoeing in 20 years?
Yep.
Alright, so tell me exactly what's going on with your foot, please.
It's getting numb when I walk fast.
Okay.
And it's giving a lot of pain when I stand for a long time.
How long did you have this problem for?
Yes, many years.
Many years.
Many years.
Getting worse with the time?
Worse and worse every day.
Okay. I want to also be able to just kind of tell and ask you about the interesting thing that you did mention. You told me that you're not able to curl up your toes. Is that correct?
No, I cannot.
So,
I cannot tip the toes. I cannot walk fast. I cannot try to grab something tall. I cannot. Like go like that.
So you cannot reach overhead. You cannot tiptoe. You cannot run fast. You cannot walk fast.
No.
And that has been going for how many years now?
Maybe 20, 23 years.
20 to 23 years. So that's a lot of years of problem that we're actually dealing with. Any other problems you might actually having? Things like the like lower back, mid back, any kind of things you're actually experiencing?
When I'm tired, when I'm overworked, I get a back pain in my lower back. At the end of the day.
But not all the time, just at the end of the day.
When I let's say that I work a lot of hours, so I'm standing a lot of time or walking a lot of time. In the end of the day, when I'm gonna sleep or when I'm gonna rest, I get the back pain.
But not all the time. The foot pain and lower back pain separate.
Yes.
So foot pain and lower backs are separate, and then you don't really feel like that there's link in between the foot pain with the rest of your body part. Am I correct?
Yes.
Okay.
If I'm standing, let's say that I'm standing 5 minutes. In the morning, I gotta open the store and I gotta call my company so they can set up the alarms.
Okay.
I gotta stand there. And most of the time, I'm standing in my left foot because if I stand in my right foot, I get a pain in my left foot. And then I went to a pediatrician and they said that it was because of the gout, because I have gout.
Okay. So because of gout, you cannot curl up to your toes. Because of the gout, you cannot walk fast. Because of the gout, you cannot run fast or do any tiptoe, anything. All because of gout. That's what they say.
That's what they say.
Okay. If I do make you feel better today, after the treatment, it does not mean that I'm taking away your gout. You probably walked in with gout, you probably will leave with gout. There won't be any changes with gout. That's why I want to be able to make sure that you understand that.
Yeah.
So if I am able to tell you that there are more than one causes that you can have a foot pain, certainly things like gout can decrease the functions of your foot, can make it hard to walk. But just to be able to say A or B or C is causing all of your life problem, it's a little unfair to say, but I wanted to make sure that you understand this aspect.
Yes.
Sounds fair enough? So I want to be able to really examine your foot so that I can actually see exactly what you mean by this, okay? So, are you able to curl up your toes for me, please? That's it? So you can do a little bit with your big toe.
Only that one.
But you cannot really curl up with this one.
No.
Okay.
And if I leave it like that, I get a cramp right there.
Okay.
See, right now I have a cramp.
Okay. You cannot really move your toes right now, right?
Mm-mm.
Okay. I want to be able to let you know that your toe functions are because of all the nerve supplies that's coming from your structure above. Namely, coming from the brain through the spinal cord, especially from your tailbone and your lower back area, you get all the supplies to your legs, to your knees, to your thighs, to your ankle, to your feet. All that is coming from that nerve supplies coming from your lower back and your tailbone area. So what I'm going to do is I'm going to go ahead and test individual toes. I'm going to test the individual nerves so that I know exactly what's going on with your feet, okay? So that's exactly what's going to be happening. I'm going to be going ahead and ask you to push my finger up, please. Push both of your big toe up. So you notice that you're not really able to push at all with your big toe. Push down, please. You can push down, but you cannot push up. Push up, please. You cannot push up at all with the right big toe. You feel the differences. That could mean that there is some kind of nerve supply that does not allow you to push up on the right foot. Does it make sense to you? You really cannot push up with the right big toe?
No.
Okay. Okay, second toes. Both of them. Once again, you cannot push at all. That's a humongous...
Now with that one, I can't even move those.
Exactly. That's what I'm trying to tell you. This is usually not caused by gout. This has some kind of structural problem, and I'll be able to explain it to you because we did take all the x-rays. But that actually is not really coming from gout, most likely not. Third toe up. Once again, you cannot push anything up.
No.
Push fourth toe up. A little bit more. push the fifth toe up, you really cannot push anything. So all in all, you cannot push anything up with your right foot. So now the question is only the toes are the only the weak things, or do you have any other weaknesses? That's exactly what I'm gonna test you now, okay? You cannot really push down with your foot. Is it where it stops? Let's find out. Your ankles. Push your ankles up. Push up. Continue to push up. You notice that you're able to push up a lot easier on the left side as opposed to the right side. Right side is still weak. All of this is weak. All of this is weak. And almost all of this is weak. Does it make sense to you? So everything from ankle down is weak. Go ahead and push back, please. Hey, you know what? Even the back of your heels, the Achilles tendon, that's also weak too. You do have a very dry skin. But do you notice that
I told that to my doctor, and she said that I gotta wear lotion. That's not gonna help it.
What supplies all the small pores, skin pores, to put more oils on? What in your body tells you to put more oils on your skin? Your nerve functions. So if your nerve functions are disturbed, you're not gonna have as much oil supplies. Does it make sense to you?
Yes.
Very, very important. I want you to go ahead and feel the both of your legs slowly and tell me which one actually has more oil. Which side has more oil?
I can see that this one has more oil. You can see it.
You can sort of see that too. Left side is dry as Sahara Desert. Very, very dry. This one is oily. This one is so dry.
Yeah.
What tells me is that there's limited amount of movements over here. You have almost no oil supplies over here. Everything seems so dry. And guess what? You also have different sizes of the calf also. And guess what? The muscles on the right side is also very flaccid, while this one is actually kind of plump. This one is actually bounced right back. Very, very, it's a very responsive.
That's because I'm dragging this foot when I'm walking.
Yes.
I don't have no movement like in this one. That I noticed.
So I know that you went to a foot doctor. Did you go to any other doctor for this kind of problems yet?
No.
They'll probably say you're probably normal and just get out of here, probably.
Yeah.
But I'm just letting you know, all this is all related. I'll go ahead and bring it all back to you, but I'm just trying to let you know everything that I just have done is related. Now, all the problem that I have seen from your leg down, all the way down to your tip of your toes. Do you have any knee problems on the right side?
Yes.
So, let me get this straight. So you got a problem here, and also to your knees.
Yes.
What did your knee doctor say?
Well, they said that I have arthritis in this foot.
Okay. And then what did they do?
Nothing. They gave me a paper that I have arthritis.
That's it?
Yes.
Okay. Alright, so I want to be able to also show you one more thing. If I'm actually able to touch your thighs right here, I noticed that you actually have a lot more muscles on the left side versus your right. Your right is very, very small.
Mm-hmm.
This one is small, big, flaccid muscles, responsive, rigid muscles. Very different. Did you know about that? Mm-hmm. Feel it.
No, I know because that's why I went to the doctor, because I know there's something wrong there.
Yeah. So you're aware of all the things I'm telling you. I want to also be able to tell you exactly what the differences are in between the muscle sizes between your thighs and your legs, so that you can know for your benefit how many years of you've been having this problem and what the consequences of your foot pain was. Okay. Mm-hmm. I'm gonna go ahead and right above your kneecap, so they will be the same place every single time. Sounds good? So, you can already see 17.5, you see it on the right side, yes? What does it say over here? 18.3, can you see? 18.3, 17.5. You have lost almost 0.8 inches of muscle mass over here. Guess why? Because nerve function is not working properly here.
Yeah.
Does it make sense to you?
Yes.
Same reasons why you have small muscle mass over here, not so good knee functions, less oily skins, although toes are not working properly. All of this is, guess what? Helping from where? Something above. You came to see me for the right foot, but I found the problems on your right leg, right knees, and right thighs. And all the skins on this side is all affected. What that tells me is your problem has to be probably above this thigh region. That's exactly where the problem is most likely coming from. Guess where that is? your tailbones and your low back area. That's the reason why that I want to be able to make this video case studies with you, because I see so many people like you going to go to a knee doctor and then they have a surgery over here. They go to see a foot doctor. Oh, well, you do have a little bit of flat foot, so they have a surgery for flat foot. Oh, I have a less muscle mass over here. Let me go to physical therapy. You chase all the symptoms, but they are really forgetting the reason why they have a problem in the first place. If you are able to fix the cause of all this, you're going to be different. Does it make sense to you?
Of course.
Okay, now do the right side. Okay, you're a little unsteady with the right side, yes?
Yeah.
Try again one more time. You cannot really hold it. Can you hold it for 2 seconds? Right side. 1, 2, 3,
Yeah,
4. Okay, so you cannot do more than 4 seconds. Gotcha. Go ahead and walk tippy toes just a little bit for me, please, so that I can compare before and after. Tippy toes. You cannot really do tippy toes. Okay. I'm gonna go ahead and examine your spine one more time. Like I said, everything that was actually affecting your right limb, right lower limb, was coming from this area, like I said. So I want to be able to examine your spine because that's probably where your problems are coming from for you, at least in your case. So without me going any further, I want to be able to let you know, just try to feel exactly what I feel, please. I feel a lot of rigid muscles over here, almost as if there's some kind of structural problem on this side. This side is even tighter, so both of them are very, very stiff. Have you always had such a stiff low back?
Yeah.
This is very, very stiff. All of this muscle, like I cannot, this almost feels like a wall, and I really do mean it. It's really, really stiff on the both sides. So if you actually have any kind of pains on this side, you probably have a lot of muscle pain, and that's exactly what you might be feeling toward the end of the day, because muscles are very, very tight over here. Does it make sense to you? Okay.
I used to be a bodybuilder, and I used to do a lot of
gotcha.
squat. Very heavy.
Very, very.
Pounds.
So I want to be able to tell you about that. I'm running an instrument on your spine to see exactly what's causing your lower back pain. How's it right here?
It hurts.
It actually hurts right here?
Yes.
Right here, yes?
Mm-hmm.
On this side?
Yes.
A lot?
Mm.
Okay.
This
This is actually nerve that I'm actually pressing. Is the one that actually goes down to your right limb, right leg, all the things actually caused by this. Do you see this? This is your lower back area. Do you see this kind of abnormal curvature that you see actually over here?
Yeah. Yeah.
This is a lot of curvature in such a short amount of spine. You told me that you used to weightlift.
Mm-hmm.
And I'll be able to tell you this actually may have to do something to do with it. So at least in your case, this actually most likely has been caused by trauma at your early age when you were doing something heavy to your lower back, such as weightlifting.
I used to do like 500, 600 pounds.
So if you look at it, you see this is your lumbar number 5. It's actually rotated this way. And then your 4 rotate this way. 3 is pointing this way. 2 is pointing this way. 1 is pointing this way. I want to be able to let you know, having curvature in the spine, I see a lot. I see a lot of them having curvatures.
Mm-hmm.
And then that's actually pretty common with somebody with low back problems or foot pains or something like that. I do see a lot. What I noticed about your case actually quite severe is that the rotations of individual vertebrae in such a short segment is very drastic. This one right here is pointing downward, but you see almost as if you see how the vertebrae are touching over here. You see there's almost no spaces. You see how there are spaces in between this vertebrae, this vertebrae. Can you see any kind of a
almost nothing.
And then you see there's a bone right here. It's touching right here. It's almost touching, but there's so much angulation. There's so much angulation is over here. Do you see such angulation elsewhere in your body? No, just on this side. Guess what? Nerve that's coming out from this area goes to your toes. It also goes to your lower back. It also goes to your knees, your thighs, and your legs, and everything. could be coming from over here. Right foot, where you have pain. This is your right foot x-ray where you have pain. It's not bad. So when you went to doctors, I can totally understand why the gout was the diagnosis for you, because if you just look at the foot, you won't be able to find much. If you just look at the foot, they'll say, well, he has gout, so probably that's what's causing it. You have some degeneracy right here, but it's not enough for you to cause that you cannot walk tippy-toe. They cannot explain that to that. Mm-hmm. The only thing that they can really say that is, well, he had gout, so there must be some problem over here, so I don't know. That's exactly what they actually say. This is not such a bad foot x-rays. This is not so bad. Your low back, different story. But your foot is actually okay. I'm gonna relieve just a little bit. There we go, a little more. There we go. You felt that? Go ahead and then send that for me, please. What's the difference?
I can use my leg now.
What's your pain level like now? 0 to 100%. How much pain do you feel now?
1, maybe nothing.
How about your foot pain? You came to see me for foot pain, yes? How much foot pain do you have? I know that you have to walk for a long time, but at this current time?
Nothing.
I know that you couldn't do more than 4 seconds on the right side, so why don't you go ahead and lift up the right side for me, please?
The right side?
Yes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 30. I think we can stop now. You can go all day, right?
Yep.
Things that you couldn't do, go ahead and walk tippy toes. Come on back.
This I like.
Yeah, you couldn't do that. How many years couldn't you do tippy toes for? One more time. How many years?
Maybe 20.
So this is your first time tippy toeing in 20 years.
Yep.
Are you getting foot cramps?
No foot cramp, no pain, no nothing.
Oh wow. Hey, that's good. If I've done my job properly and take care of the nerve supplies as much as I can, you should start to experience some kind of a strength improvement on all the weaknesses you had before. So I'm going to test the strength all on your leg, your thigh, your knees, and your feet and ankle, everything, so that I can know that I've done my job and that you are in course for healing, okay? Yeah. So go ahead and push this up, please. Hi, strong now. Do you notice the difference? Push up, push down, please. That's not bad at all now. Push down. Now it's pretty much equal. Do you see the differences now? Mm-hmm. Push out, push in. It's not like before, is it? It's not like before. Push out, push in. Hey, it's not bad at all. It's working pretty similar now. Do you remember pushing your ankle up? The other side too? Both at the same time? Both at the same time, please. It's almost equal. Draw back. You can actually do more with the right side than your left side now. Do you notice the differences?
Mm-hmm. Yeah, I can feel it now.
Big toe up. Both of them. It's equal now. You couldn't do that before. Remember that? Mm-hmm. You start to change, you start to feel the much differences from the moment I treated your back.
Your back, yeah.
You can tell what the condition was. You told me yourself, mm-hmm. I don't have a lot of back pain. Back pain only comes once in a blue moon. But guess what? What was causing your foot pain? Your back or your foot?
My back.
Your back was causing your foot pain, yes? Mm-hmm. You can clearly see that. Let me just...